Hello everyone, welcome to an all new edition of Viral. I'm your host as always, Anthony. Glad you can join us here on Viral as we talk about social distancing. Alright, many people know that once the coronavirus, social distancing has become more prevalent and more important than ever. But first things first, join in the conversation using the hashtag Viral and join in the conversation with us. Plus, don't forget to subscribe. Subscribe is caring. We talk about the social distance policy. And many people are going a little bit crazy as a movement for social distance. When people going from grocery stores and packed houses now have to go one at a time on limited shelves and stuff. We're not having dinner in front of public places no more. It used to be you had to have your dinner at curbside on drive-through. And working from home. People dealing with the effects of working from home due to the COVID-19 pandemic. So a whole bunch of new things coming into play. Some say we need social distancing to reduce the spread of the COVID-19 pandemic outbreak, which said the spread could grow and increase in the coming weeks and stuff, and prevent large crowds until further notice. Make sure people use good hygiene. However, people are continue to defy orders from their government local officials. There they go. Let's go back to the 719 press conferences with Trump and a lot of health experts that's dealing with this effect and see how they're going to curb the social distance. Curb the outbreak. Take a look.
The news right now is pretty clear. Stay home. But one, it feels not that convenient. And two, it's only fun for like a day. Why are we doing this?
For people who are at high risk of complications for infection, social distancing rules help them protect themselves from potentially severe infections. But really for all of us, even those not at risk of complications, it's important for us to follow rules and tips about social distancing in order to protect our friends, families, and loved ones, and those who may be at risk of severe complications from infection.
Okay, so keep your distance. How much distance are we really talking about here?
6 feet of distance is recommended because COVID-19 is transmitted by respiratory droplets. Respiratory droplets, when we cough, typically travel an average distance of 6 feet or less. So by maintaining 6 feet of distance between ourselves and others, we can make sure that if someone does cough and doesn't properly cover their cough, that those respiratory droplets won't reach us and become a source of infection.
Got it. So we all stay at least 6 feet away from each other, and this all goes away, right?
Social distancing has been recommended numerous times before. Early social distancing has been shown to be effective in slowing the spread of infectious diseases like COVID-19. Social distancing helps high-risk individuals by decreasing transmission of the virus. By separating ourselves physically, we can help prevent transmission from person to person and slow the spread of the disease.
That is super encouraging. On that note, what can each of us do that helps stop the spread of COVID-19?
Tips you can use for social distancing include things like avoiding crowds, avoiding any situation in which you can't maintain that 6 foot distance separation between yourself and others, limiting groups to 10 or fewer, so long as the 6 feet can be maintained, frequent hand washing, frequent cleaning of high touch surfaces, and staying home if you have a cough or fever are critical to help slow the spread of COVID-19.
All of this sounds great, but I'm probably going to run out of some essentials eventually. Is there anything I can do to still protect myself and others while I'm out in public?
If you still need to leave the house, you need to be very cognizant of everything you might be touching. Any high-touch surfaces like doorknobs, door handles, shopping cart handles, countertops, bathroom sinks. After you touch these surfaces, you need to be very careful not to touch your face and to wash your hands with soap and water or to use hand sanitizer if soap and water are not available. I know that it can be difficult to follow the tips and rules for social distancing. If you're feeling stressed or cooped up at home, one of the best things you can do is just go out of your front door and take a walk in the neighborhood. So long as you maintain a 6-foot distance separation between your friends and neighbors, it can be a great way to de-stress.
There are press conferences from President Trump, Vice President Pence, and many others, and many other social health experts, like Dr. Deborah Britt.
Asking everyone to be selfless for others so that we can protect those who are most susceptible.
Dr. Anthony Fassini.
Not going to bars, not going to restaurants. It all just means physical separation so that you have a space between you and others.
For more information on how you can social distance, please go to coronavirus.gov.
And Surgeon General Jamal Adams.
Why should young people care about the spread of coronavirus? Well, we know that people with underlying medical conditions over the age of 60 are at highest risk, but they've got to get it from somebody.
All practicing and preaching that fellow Americans need to social distance at this moment to curb and stop the spread of the COVID-19 disease. A lot of Americans, some of them being obedient and some of them aren't. So it's like the question tells, people who are Americans instead of some Americans are introverts. And the introverts are taking it well and swell, but the extroverts aren't, because they're not used to the realities of being inside their homes at that moment, at that crucial moment during this turbulent time. So it's kind of new to them because they have to become introverts as well, but they don't know how to become introverts. So it's just a double standard when it comes to social distancing, and they're going to practice that. And now all states, including all nations, are doing 5 p.m. curfew to stop the spread and stuff. So this is becoming the new norm. We have to wait and see how all this comes about. All right, let's hear what you people had to say out there and with how you are dealing with the social distancing during the COVID-19 pandemic. Take a look.
Believe it or not, people are still not following the social distancing guidelines. Ay, vez mir. And it could have some serious consequences. So Liberty University in Lynchburg, Virginia, decided to bring back its nearly 1,900 students from spring break, despite all the fears around the coronavirus. Well, now nearly a dozen students are sick with symptoms, and 3 have now gone to the hospital for testing, according to the New York Times. In Louisiana, congregants came in by the busload to Sunday's church service at the Tabernacle Church. An estimated 500 people of all ages filled the church, totally ignoring the state's ban on gatherings. Louisiana is, of course, one of the nation's growing hotspots with more than 3,500 cases. Of course, Mardi Gras didn't help that. Finally, check out this farmer's market in Brentwood, California. That's right near Santa Monica. It's an upscale Los Angeles neighborhood, and it was open this weekend and looks to be packed. So I'm not trying to rant on anyone here, but the more beds you take up are fewer beds for grandma and grandpa, and maybe even your parents, and maybe even you. So that's the point, is you don't want to overwhelm the system. What do you think should happen to these people?
I don't know if anything should happen to them. I mean, what are we going to do? Make them wear a scarlet letter? I think sometimes it's almost like when your parents, when you would get in trouble and you were expecting to get a spanking or get punished out somewhere, and your mom just looks and says, "You really disappointed in me," and just like that stays with you 30 years later. Oh, I think, like, when it comes out, who did what they were supposed to do, who stayed in their place for 2, 3, 4, 5 weeks and did what they were supposed to do, and who didn't. When that comes out, when it all comes out in the wash, I think whatever the guilt they have to walk around with will be their scarlet letter. Yeah, I think so too. And you're seeing a lot of those spring breakers apologize now, saying, "I offer my sincere condolences," and all that stuff. Just please know, beds are important. They are vital right now.
Into a live look now at the beach with spring break underway. The beach is one place where everyone seems to be going despite warnings about large gatherings. I want to show you this video that our crews took earlier today. Look at this. Thousands of people filling Clearwater Beach, all while local leaders were inside discussing restrictions on beach access. ABC Action News reporter Sarah Hollenbeck is in Clearwater talking to city leaders about the changes that could be coming.
The threat of coronavirus isn't keeping people away from the sand. We found packed coastlines all the way up and down Pinellas County's beaches. The beach is slammed. Traffic is jammed as thousands of people flock to the sandy shores of Clearwater Beach.
If you look around, people are still just living their lives and doing everything. The restaurants are packed, the beaches are packed.
With theme parks and nearby attractions closed, visitors from Florida and across the nation snagging a spot in the sand.
We're definitely still worried about it, but it's not something that we're letting consume our spring break, I guess.
Clearwater leaders met Monday to discuss the idea of adding curfews for the beach or closing down the sand altogether. They chose not to make a final decision, awaiting more guidance.
The county says Clearwater, St. Pete Beach, Indian Rocks, close your beach or, have a curfew, then it would impact us and we would do it.
Our photos of busy Clearwater Beach creating a firestorm online as the CDC preaches the importance of social distancing.
We're not real worried about it because we're on the sand and it's an open area. There's not a lot of doorknobs and not a lot of things you can touch.
Miami and Fort Lauderdale leaders recently adding mandatory 4:30 curfews at several beaches, including South Beach, to tackle the potential spread of COVID-19. In Clearwater, city leaders are urging beachgoers to be proactive.
So I can't fault somebody from wanting to go to the beach, but if they're not well, then stay home.
These girls say they're not going to let COVID-19 stand in their way of having fun.
And we have really strong immune systems, so I feel like we're able to battle with this virus.
Clearwater Beach leaders will meet again this Thursday and could decide on a curfew then. Reporting on Clearwater Beach, I'm Sarah Hollenbeck, ABC Action News.
When we've dealt with tough times in the past, the country has rallied. And what we're seeing now is the country is rallying.
With early signs that the coronavirus outbreak is plateauing in New York and other hotspots, and with stay-at-home orders in place throughout most of the country, some U.S. health officials are now saying the pandemic may kill fewer Americans than recent models have projected, including one done a week ago by the White House task force, which estimated at least 100,000 deaths in the U.S. U.S. Surgeon General Jerome Adams was pressed on the issue on CBS.
Does that mean if we're beginning to see the flattening of the curve that we may not reach that projected number of some 100,000 deaths?
I am hopeful that we won't reach that peak, and I'm hopeful because the projections that we have been working with were based on data from other countries. We're seeing more and more data come in from the United States, and that's informing these projections in a new and better way.
The pain is increasing, the grief is increasing.
But amid the rising optimism, New York Governor Andrew Cuomo on Tuesday delivered some sobering numbers.
The bad news is 5,489 New Yorkers have lost their lives to this virus. That is up from 4,758. That is the largest single day increase. That's 731 people who we lost.
The most deaths in a single day in the state follows days when the numbers were flat. But Cuomo did say New York may be reaching a plateau in the total number of hospitalizations, with sufficient supplies to handle its cases. With Italy and Spain also showing signs of new cases and deaths leveling off, and China reporting its first day with no deaths from the virus, there is much talk about when countries and their economies can reopen. The World Health Organization on Tuesday said it has no blanket recommendation for when to ease restrictions to slow the spread of the virus, but urged governments not to lift them too early. That's a point every top U.S. health official has made, especially the Surgeon General, who even put out a video teaching Americans how to make their own masks.
We know mitigation is working. We are seeing progress, but America has the power to change the trajectory of this epidemic. The public really needs to keep doing their part.
More than 11,000 people have died of the virus in the U.S., with more than 370,000 confirmed cases.
Whole bunch of stuff going on at the moment with the social distancing that you people, some of you would agree and some of you are not. But all have to follow orders until everything comes into play. Hey, you know how that goes. We have to do what we can at the critical moment. And if we can beat this thing and we can win this thing together. See how far this all plays out down the road. All right, that's been social distancing, the COVID-19 pandemic. Been your host, Kenny Gibson. 4th hour. See you later.
We know that we're asking Americans to do a lot right now. So we're asking everyone to be selfless for others so that we can protect those who are most susceptible to this virus.
A question I often get asked is why should young people care about the spread of coronavirus? Well, we know that people with underlying medical conditions over the age of 60 are at highest risk, but they've got to get it from somebody.
Social distancing is really physical separation of people.
It's what we refer to when we ask people to stay at least 6 feet apart.
Not going to bars, not going to restaurants, not going to theaters where there are a lot of people. It all just means physical separation so that you have a space between you and others who might actually be infected and infect you.
We all have a role to play in preventing person-to-person spread of this disease, which can be deadly for vulnerable groups. For more information on how you can social distance, please go to coronavirus.gov.